going away? Okay. Was that fun? So far, so good.
I can feel like the fireplace is stone. We're gonna do that after your presentation, so I'll send okay.
Well, that's what we were just talking about. Probably participate in this ribbon cutting? Maybe do a board member?
Can I have your attention, please? On behalf of the board, the medical staff, and the employees of Titusville Area Hospital, thank you guys for coming. Really appreciate it. It's so nice to celebrate something positive and something as beautiful as this new lobby. So thank you all for being here and sharing this evening with us. I'd like to thank a couple of people. All of this work was done really between Howe Construction and the maintenance staff. And our maintenance guys, they are just a phenomenal bunch of guys. They do really, really high quality work, and they put in a lot of extra time, a lot of extra hours, a lot of evenings, weekends, and nights to help give us what we all see here today. And I just really want to recognize them for a job well done. I forgot to tell you who I am. I'm Lee Clinton. I'm the CEO of Titusville Area Hospital. You know, we had an old lobby that didn't really give us the first impression that we wanted to give our patients. We have about 25,000 people a year that come through the lobby and register at these registration desks. So when you add the people that register, and you have the visitors, the guests, the vendors, and just the variety of people that come through here, we're talking about 30,000 people a year that walk through these doors and gain their first impression based on what they see. And we wanted to make sure that that first impression was a good one. I couldn't be more pleased with the way this turned out, and I think it's undisputed that it's really a beautiful place now. We had some very generous donors that helped us with the funding of this. We had about $80,000 in donations from different individuals and from some charitable trusts, and I want to recognize them here this evening. The John Henney Charitable Trust, the 5M Foundation, Catherine Q. McKinney, and the Fleming Family Foundation. So between those four individuals and or groups, we had about $80,000 in donations to help offset the cost of this stuff. They deserve a round of applause. So I've got a microphone, so I have to brag a little bit. So we've been doing a lot around here at TAH. You know, I try to brag about the ER and what we've done in the ER and been able to accomplish over the last year. We've done a lot to improve the timeliness in the ER. We recognize that that was an issue, and we had some good people that put a lot of hard work in, and we have reduced our door-to-doc time and our total time in the ER substantially, because we want to make it as good as an experience as we possibly can for our patients. And our foundation, we recently revived the foundation. It had a 3 or 4 year kind of hiatus. And so we've revived that as of July. It was our first kind of new meeting in the last couple of years. And the decision has been made that we want to, now that we've improved some of the quality and the process issues in the ER, we want to make some physical improvements as well, some aesthetic improvements to help the flow and kind of help the experience from a physical perspective. So we are launching a capital campaign for the ER to improve that. So that'll be really exciting. In addition, I want to brag on the clinical staff and the physicians. We've accomplished a lot in this last year from a quality perspective. We achieved the maximum score on the Highmark Quality Blue Pay for Value program this last year. TAH is rated as a 5-star out of 5 in patient satisfaction by the Centers for Medicaid Services, Medicare Services. We scored a 96% in the CMS core quality measures. And we've been rated a 5-star hospital in the Medicare Beneficiary Quality Improvement Program. So we've done some really exciting things, trying to elevate the level of care for our patients, and all the credit goes to the nursing staff and the physicians here. They do a fantastic job. Very engaged group of individuals. Finally, have some exciting news regarding our physical therapy program. We partnered with, or we are partnering with Oil Valley Physical Therapy starting September 1st, where we are going to partner with them, where we have our outpatient physical therapy relocated to their existing location on Central Street. It's going to provide significant better access, better parking, nicer environment for our patients. And through their staffing, they're still going to see the inpatients here at the hospital. So we're not closing the inpatient program here at the hospital. The inpatients will still get the therapy that they need, but our outpatients will have a much more convenient and nicer environment to receive their care. September 1st. Really excited about that. I think it's going to be great for the community. Okay, with that, what we are going to do, we are going to have a ribbon cutting with the Chamber of Commerce, and then following that, at 5:30, we're going to start the Lyme's disease presentation by Dr. Sonnenberg. It's going to be in the cardiac rehab department. Around the corner, follow the signs. Before you go, please help yourself to the punch and the snacks that's over here by this door. And we also have we have a raffle going on for some giveaways over at this desk. So put your name in there. Grab some snacks. 5:30, we're going to have the presentation on Lyme's disease from Dr. Sonnenberg. Thank you all for coming. Really appreciate it. Where's Steve? There we go. Brenda and Jill, you guys want to come up too?